medication? He said, no, of course I did. That's not a good feeling. So for a source of infection may become a health interruption somewhere else. And the materials in the mouth open up and look. You'll see these nice white crowns, but if you look on the inside next to the tongue, you'll see a black band around there. That black band means that that porcelain crown is stacked on a metal. And there can be anywhere from 3 to 6 different metals to keep the expansion rates similar to your teeth. So when that crown expands, the tooth expands the same. And they go back and forth. That way they don't fall off. So if you have mercury, the gastrointestinal lining can be affected by that, your muscles, joints, and other parts of the body. So, there may be periodontal ligament can interfere with the energy flow. Now we're talking meridians, and that's where I lose a lot of patients. They don't understand that your crystal things flow through. And impacted wisdom teeth, you have heart problems, circulation problems, and small intestine problems. So your duodenum and jejunum, if they aren't working properly, how are you going to get your vitamins and trace minerals and everything else where they need to go? You won't. So nutritionally, you suffer. So where do we go from here? What are we looking for? If it's the only entrance and you're not allowed to enter, where do you go? We go to the tooth chart. Now, this is my website. On the first slide, if you need to get a hold of me, it's doc@mydentistaz.com. And I do try to follow those, and I can give a phone number that you can always reach me at, which is my cell line. My wife doesn't always like that so much, but that's life. And if you want to look at this tooth body meridian chart connection, it's on our webpage, and you can go there, and I'll also show you where you can buy it if you're interested. It's a few $100.
Oh yeah, can you tell us that right now, please, because I need one.
Well, I'll tell you in the presentation, because it's at the end of this, I promise. And Jamie, if you contact me, I should have 1 or 2 of those charts you can put on the wall. Okay, so
Thank you.
these are your 5 meridians. This is your urogenitals. This attracts people. What's interesting is it's your ovaries and testes, it's your kidneys, bladder problems, or adrenal glands. I will assure you, if you find somebody that has root canals on the outside of those 2, called the laterals, they're going to have chronic fatigue and fibromyalgia. Any 8 of these, you're going to have adrenal exhaustion over a period of time. And then I don't even want to go into all the things of miscarriages and stuff like that. But we see it there. And when you go in here, in the tooth chart, if you push the button of each tooth, it will start with the meridian, it will go to the organs that are affected, the glands, and then what part of the spine it affects, which sensory organs, sinuses, lower musculature problems. I have a son that competed in Taekwondo, and he pulled a muscle. And when I came down here, 23 will affect your lower extremities, and 22 affects your hips. I gave him acupuncture injections there, and he was able to compete with a full muscle with no pain. And then you have all the other relationships that it is connected to. So you can sit down and read through these things, and it's quite amazing. We have a patient that was referred to me,
What if they've had these teeth removed?
if the area is cleaned properly and the bone fills in, we generally don't have a problem. But if there's a lesion in there, if it hasn't healed properly, we're checking on a gentleman who has a posterior drainage all the time. It comes back, they can't find it. And it looks like he has exactly that situation. There's another question?
What if they're not born with the teeth?
When you have congenitally missing teeth, it's kind of interesting because sometimes the tooth bud is there and it doesn't develop. This is more in the third molar areas. We have found it in the premolars too.
Or what about like they had the primaries that fell out but there was no secondary?
Right. Sometimes the tooth bud could have been there but never developed, and there can be a hole there, and the cavitat will pick that up.
Okay.
Yeah, but that's an excellent question. Any other? Hey, by the way, this is informal. Okay, so if you have questions, please don't be afraid to ask.
I have
Yeah.
What about just with like alignments and, you know, either braces or things like that? Does that affect your intervention
Braces
rate?
are a great thing to have and have the teeth straight in line and have them functional. But I've seen so many braces done on people who are called a class 1 with the perfect bite, and they're all screwed up because they didn't check to see what the relationship of the jaw was to, you know, the condyle in the mandibular fossa. And then the other aspect is your tongue. Where's that tongue going? It goes to the hyoid bone, it's wrapped around there, goes to the clavicle and the upper 5 cervical spinules. And so what happens is, if you have a spine injury, it can affect the neck. It affects the neck, it affects the tongue, and it affects your airway. So the biggest problem with braces, and I'm finishing up my last few cases, the metals. You're using a nickel titanium, which is really crappy for your immune system. So you have to really, when kids are going through that, you have to talk with the parents. I try to get the parents to take the kids to a naturopath or a homeopath, one of the two, and make sure their immune system's functioning. And we find that the kids do get a little more sick, a few more colds, because it's a natural immune suppressant. Any other questions? Okay, remember, we gotta get through it yet, but go ahead.
Do you notice the same kind of problem when people have the baby or the primary teeth pulled rather than the adult teeth?
No, when baby teeth come out and the adult teeth come in, the bone has to dissolve so the tooth can come up. That's an excellent observation. So we generally don't find those problems. I do know one dentist that feels that when they pull out adult teeth and then the braces are done, she says she finds spaces in between the canine and the premolars on top that cause that problem. I've never seen it. And I've been trained to look for those things. So, hand over here, yeah.
What about a fake tooth? Does that affect the meridian system?
Depends what the fake tooth is. Are you talking about an implant? Are you talking about, we're going to go to that. At the very end, I added something that's a little different that I haven't done before. So I'm going to test it out on you guys. See. Keep that question, come back to it. This is the liver, gallbladder meridian, your eye teeth. Yes?
Are you talking more, for the things that correlate, is it more the tooth or could it be the gum that's associated with the
More the tooth than the bone.
Okay.
So what happens here is your canines, if you take a look, you can see hip, knees, and foot, goes through there. Then we go to the large intestine, lungs, and thymus. T cells are kind of important, so you maintain your immune system, and this goes through, and you go through each one of these. And I don't really want to do that because it'll take up way too much time to explain each one, but you can get on there, it's free, it's simple. This is where I got the injury with the with tooth number 3, my first upper premolar, and my stomach had a problem, the thyroid increased in size, misdiagnosed with cancer, kidney stones twice that summer, and mammillary glands. Those 8 teeth, when I see that, I always ask my female patients, do you have more fibromas of your breast on that side of your body where the root canal is in those sites? And 95% will say yes. So if they have that, you want to get those root canals out. And then you go with that. So that's why I'm diabetic today, because it affects the pancreas. And you go through there. So we come here, and we see heart, blood pressure, circulation, small intestine, dental, jejunum. That's your wisdom teeth. Are they really smart or not? I don't know. So we go from there. And here you go, Jamie. There's the number. 888-708-2525. When you talk to Doris, tell her that I sent you. Or meridiantoothchart.com. Tell me when you're done, ready to go, and we can go from there.
Thank you.
You're welcome. Anybody else? Everybody up? Here we go. Section 2. It doesn't matter what you think of yourself. I can't tell you when you get done with a cosmetic case and we clean somebody's mouth up that looked awful and they got the most fantastic smile, what it does. Well, let's talk about some other materials that don't give you that great smile. Let's talk about dispersaloids. Use of amalgam is contraindicated in the proximal or occlusal contact dissimilar metal restorations. Not only do we see gold crowns put on top of mercury fillings, but around the side, mercury fillings are placed here because of re-decay. Patients with severe renal deficiency, who has an allergy to amalgam? Anybody got an allergy? What kind of bullshit is that? Seriously. Are you allergic to arsenic? How's that? Arsenic is less toxic than mercury. And then retrograde, which means filling the root canal from the top, had a lady come in. She had every one of these front teeth from canine to canine root canal and had apicolectomies on every one, and it was pitch black across the front. She saw 3 specialists. She wanted to make them pink, and they all said, well, what we'll do is we'll cut out the tissue, and then we're going to take a piece from your top of your mouth and we'll paste it back in there. Well, that was getting rid of the black for about 3 to 6 months. Then the black would keep on coming out. We went in, did the surgery, dissected the tissue, put it all back together, and I said, I'll see you in 6 months. She said, why? I said, you'll see why. It was blackening it, not as much. Children over 6 or expecting mothers. Gee, why should we give those into that classification neurotoxic metals in their body? Now let's see if we can get this thing to run. We should. Can you hear it? Okay, let me just narrate it. This is a tooth that had a filling 25 years ago. It was extracted, and that's a mercury filling. It's a phosphorus screen, and David Kennedy will tell you about this. It's called Smoking Tooth on YouTube. It's really good to watch. And what it shows is that the mercury vapor is still there. All you got to do is rub it, heat it up, and it will go into the air. At the level of a chewing or hot coffee, you are releasing mercury vapors into your lungs and your mucosa of the mouth, which absorbs. If somebody has a heart attack, where do you want to put the nitroglycerin? Under their tongue, because it's absorbed. This is being absorbed all the time. Now I want to try to get this next one. This is really a good one that needs. Let's see if we can do this, get this right. Got that as high as I can get it.
How mercury causes brain neuron degeneration.
On the screen.
Mercury has one.
Okay, let's try it again. Thank you. Can you hear it?
Yeah.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer's disease brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal direct visual evidence from brain neuron tissue cultures how mercury ions actually alter the cell membrane structure of developing neurons. To better understand mercury's effect on the brain, let us first illustrate what brain neurons look like and how they grow. In this animation, we see 3 brain neurons growing in a tissue culture, each with a central cell body and numerous neural processes. At the end of each neuron is a growth cone where structural proteins are assembled to form the cell membrane. 2 principal proteins involved in growth cone function are actin, which is responsible for the pulsating motion seen here, and tubulin, a major structural component of the neural membrane. During normal cell growth, tubulin molecules stick together end to end to form microtubules, which surround neurofibrils, another structural protein component snails to humans have identical structural and behavioral characteristics and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the reduced neurofibrils seen here. In contrast, other heavy metals at the same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. To understand how mercury causes this degeneration, let us return to our illustration. As mentioned before, tubular proteins link together during normal cell growth to form microtubules which support the neurite structure. When mercury ions are introduced into the culture medium, they infiltrate the cell and bind themselves to newly synthesized tubular molecules. More specific.
Oh, don't do this to me. Well, you know it. Well, okay, it died. Why, I don't know. Now it's starting at the beginning, we're not going to listen to it again. Basically, what it is it destroys the structure for the nerves to develop, and therefore it can't function. I mean, this, okay, so mercury is scientifically been proven to be a neurotoxin. 50% of the mercury filling is mercury, dental amalgam, I should say. Because they don't like to say, they say silver fillings, they don't like to say mercury fillings, even though I was always taught to take the largest component and name that product by the largest component. It's more toxic than lead, cadmium, and even arsenic. It leaves the dental amalgam consistently. The vapor is the main way that it goes, so you're going to get it either in your buccal mucosa or in your lungs. Galvanic charge, when you get pulp fillings or gold restorations next to an amalgam filling, you're going to have charges going back and forth. You've created a battery. The author says in this, the interaction between metals and saliva causes electrical current to occur. It may cause it. And I've always, he says it's rare, but if you have the right conditions, and it's physics that we're talking about, it'll happen 100% of the time, not once in a while. The mouth is full of saliva with salts, enzymes, components of our immune system. All these components of metal restorations react to create the galvanic charge, depressing the body's ability to protect itself. And over here is an example. If you go to the upper left corner, you'll see that the amalgam filling is there. If you magnify this, the margins are really cruddy. They crack down over a long period of time. And then we just removed it. You can see the stain. It's important that the dentist remove the outer part of the stain, but not keep following it through, or you're going to wind up into the nerve, and then the tooth is dead. We cleaned it up in the lower left corner, and that's the final restoration. Patients come back amazingly talking about the difference from everywhere, from their personality to having body functions work better. Yes?
What are you filling it back with?
I use a composite resin. There's, in that Clifford test, there's about 800 different products that qualify as composite resins. So what we look at is a blood antigen test to see which classification. I've used this since 1995, and now, it's almost 20 years. And what's pretty cool is it used to be 100 products that we were choosing from. Now it's approaching 900. And not all of them are good. And you'll see the dentist use a blue light to set the material. That's the catalyst. You don't take shortcuts on that, because bisphenol A is part of that. Bisphenol A destroys genetic properties of the body. And so you have to make sure you set this material. You can set it to 99% set by the time the patient leaves, and the rest is internal. So it's not really an issue unless you're going to live about 1,200 years. If you live 1,200 years, then we've got an issue. Okay, what can we do with the new material used? Here we go. I'm going to talk a little bit about blood antigens, EAVs, and let's go back. The blood antigens and applied kinesiology. I do a lot of applied kinesiology. I don't know if the school endorses this or not. These are the two companies that are out there. The one on the right is what I use because it's all in alphabetical order. The other one does it differently. This lab on the left was originally set up by Mr. Clifford, and he and Hal Huggins, both of them are my friends, had a falling out. So Hal fired Clifford, and Clifford went down the street and opened up his own place. Just the way it goes. Anyway, the cons and the con with the problem with blood antigen testing is it's a time and place. And it can change once you're introduced to new products. So I've had people where we've placed products in and we were consistent in what we use, and then 6 months later they get a reaction to it. So then I can send them to somebody who does allergy elimination, which has been very, very successful in this community. I'm very lucky because I've got a lot of guys who do NEAT or other methods of detoxifying people. So electroactive acupuncture by Vol, there's so many machines out there, BioMeridian, Zygot, Sera, and it depends. Some are operator dependent, others are not. So the pros and cons, they're operator sensitive. You don't always get the same results with two different people. You can test materials in one's body. It's on the spot. It's a device that can print things out. Other document situations for that. Applied kinesiology is very subjective. If you don't know how to do it, or if you haven't gotten a lot of practice, I use a chairside assistant with me because we've been doing it 14 years. And I don't have this big guy who's got muscles on muscles on muscles. We've had a few NFL players come in, they got big muscles and they use starch for deodorant. And they go out like this, and they don't want you to move their arm. They don't get the idea of balancing force to force. So I use an assistant for that. We've liked it. We've been successful with it, and I know some people just can't do it. My preferred way of doing this is take a good health history, order the Clifford test for over 10,000 products, and they list it. May be suitable, not suitable well at all. And always take a good health history. A section that refers to allergies, ask the patient, are they allergic to anything not asked in your form? Most patients don't think of foods, clothing. This is your alley. This is what you guys do the best. Have they had any reactions to their clothing, jewelry, watches? It's amazing how many times you get people on the Clifford test that are reacting to metals. And I asked them, what about your wedding ring? And this lady comes in, she's got jewelry everywhere, and she takes her wedding ring off and it's green on her fingers. Could that be the reaction that this test is telling me about? Yeah, it is. So this is what a Clifford test looks like. That's the front page. Here's the good part. This is the patient, their name and everything. This is the bad part. This is what you react to. And if you could read this, arsenic, beryllium, lead, mercury, nickel, thallium, and thimerosal. What do they all have in common? What? They're poison. They're poison metals. How many of you want to put lead in your body? I think so. Would you like to add a little beryllium? Beryllium's been outlawed in the United States because lab techs were grinding on crowns that had beryllium. They got lung cancer. Nothing important there. Lead, mercury, and nickel, all carcinogenic. So this test will sit there if that product is in a product, and even if you don't react to it, they list it as bad. And this last part, this is not so ugly. Those are the things that are really good. And so the test, consider different materials. It's a blood antigen test. So one lab will state that all implants are bad. And Clifford will sit there and tell you that when you look at the reaction. So titanium and zirconium are actually on the same column in the periodic table, but zirconium oxide is a ceramic implant. And the guy who asked about it's gone. Oh, well, you have to tell him later. I know that sometimes you guys have to go to different places, so it's not a big deal. I just didn't get to his answer. So this is listed in 2 different areas, and this is what a page looks like. And it goes through, and then you see all those S's, and then you see 2 letters together, that's NS. Those are composite resins. And we just go through this. Here are porcelain, ceramics, so there's no metal involved here. And then what do you look for? Anything with an EX3 in porcelain has nickel in it. So it's a carcinogenic, so it's listed as bad. And you should be able to see that somewhere, not on this page, the next, I don't know. We didn't put the whole report in there. And then over here, this column here starts ceramic alloys or precious metals. These are the good metals. And on that 3rd column over, you're going to start seeing a lot of NSs on this person. That's the page. When you start seeing people with NSs like that, it's not good. And then on the very last part, he finally tested amalgam fillings. Guess what? None of them are good. Why? They contain mercury. So one of the things is, in the current climate of patient awareness and concern about what is being placed into their bodies, has led many to read popular books about toxic products and dental restorations. Even well-meaning dentists are advising patients to demand metal-free dentistry. It tells you that, honestly, there is no such thing in nature. This ought to be modified into recommending that patients demand dental products with non-dissociable metal forms. It's not throw the baby out with the bathwater. If they can safely walk on sand and store their food in a glass container, there really are safe metal forms. So when you look at this stuff, to me, it's kind of boring. Okay, two cases here, or 1 case here, 2 cases coming up. Get into the clinical stuff, and let's see if we can get the computer to work. This is a gentleman that came to me, who was referred from Tucson. You'll see the titanium implant in the front canine area, and then look on the lower right side here, which is the patient's left second tooth from the end, is actually what we're going to be treating. When I first met him, he had this implant, and it was causing him a lot of problems. The problem with titanium implants is they're metal and they oxidize. So oxidation is rust. And when I go in there and clean this stuff up, it's not uncommon to easily take out a titanium implant because the bone doesn't do well there. And at first, bone fills in really well, but then it starts oxidizing. Sorry. It starts oxidizing, and it's a problem for the patient. So here's a cavitat. If you look, this is the lower left side, and tooth number 19 and tooth number 17, you can see that the bone doesn't look as good as the others. So that's the problem. So we combine the cavitat. Now you'll notice that the crown is missing, the implant is missing, and here's the cavitat. This is the 3rd molar area where the tooth is missing, and 2 up is where that tooth is missing a crown. So we scored our cavitat, we went through 0 to 4, and then we take a look at the patient, and that's the surgical site coming up. So you can see where the tooth is broken off and the area behind the tooth. Now, I did this presentation for a group of dentists because a lot of guys don't know how to do these surgeries and they want to learn. So we go ahead, we open a flap, we move the tissue down around the tooth. Be careful not to cut what's called the mental nerve. The mental nerve is down here. It allows your lip to move and give you feeling along the face. So we're going to go ahead with the extraction of number 19. We take that out and we're going to put it in a biopsy containing sample. And now we take a look at the socket. This is where I wish I had a pointer. All that red stuff is infection and part of the periodontal ligament, and you don't want that area to look red. So I start scooping it, and you'll start seeing some of the crud come out, and we start lifting it out, and we put that in the biopsy for evaluation. Now this is where you have to teach dentists where the third molar is, because most people think it's behind your second molar. It is behind, but it's also to the outside of the jaw. If you go straight back, you're going to be cutting down into the throat. That's not a patient pleaser. So that gives a pretty good perspective of where it is. And now I've opened that up, and look how red it is. Bone is white. It's not supposed to be like that red. Yes, it will bleed, but those are soft tissues and soft bone, and we start taking things out. Marty was such a great guy that he actually let me take another x-ray to show the two spots where the extraction was and the third molar, and this is the nerve along here. This actually, when we cleaned it out, it doesn't show up very well in the x-ray. We were actually on top of the nerve looking at it. So we go ahead and we look at these two sites, one here, there, and there, just to get the perspective. Now this is bleeding in there, and that's what we want to do. I used to use artificial bone. I now use cadaver bone. We muscle test to make sure that it's okay, but we have a place that gives us clean bone. I've had it tested in 2 different DNA labs, and the procedure is considered by them the best they've ever seen. So we place it in, and then we use Vicryl, which is a type of suture material. It's not nylon, Teflon, and it falls out in 28 days if you don't take it out. I also use Medical products, pleomorphic products, and we're going to show you another thing in the next surgery that we've added. But we do ART, A, F, neg, and NOT. If there's not a major infection, we need circulation, we'll use Muke, which we mix that with Camille. And if we're trying to get the sinuses open up, we add Quint. And this is what we're all striving for, right? Isn't this what our government, Obamacare is all about? Affordable health care, amoxicillin, Ritalin, appetite suppressants, no-dose, Prozac, Zantac, and everything else. I wonder if you can make homeopathics for these things. Is Mike in here? Our chemist? Anyway. And this is going to be the last section, so I will be getting you out a little early today. Sorry, but I will answer questions if you have more. Zirconium oxide is a ceramic implant. It is not for everybody. Some people shouldn't have implants at all. And we screen our patients. But we have a patient here. They have some discomfort with tooth number 7, which is the front one, a little off to the side. And when we look at it, the root tip has a shadow, which indicates there is a past active infection or possible infection. Patient wanted an implant placed at the same time the tooth was extracted, depending upon the ability to rid the area of infection and bone structure after the extraction, if there's enough buccal or outside bone. One of the problems is when you take these out, there's no bone on the outside, and then we have to pack it, but it heal for 6 months on the upper, 3 months on the lower, and we can generally put an implant in if the patient's healthy. One of the things that we've started doing is we're preparing for the patient for plasma-rich Fibrogen, and I want to thank some of your students because they're the ones that taught me. You're so good. Thank you. Now, where did you find it? Thank you. Because you guys taught me how to draw blood. In dental school, we're not taught these things. So we go ahead, we find the vein, drainer, put it in our centrifuge, and then when it comes out, it's pretty cool. I think if you've ever spun blood, you'll see that the plasma is here, the blood's down there. Blood's got all the crap in it to get rid of it. The plasma is really cool. We put it in a container and we squeeze it down to flatten the membrane out. And then we get going here. Here's the extraction of the tooth. Thank you for the pointer. I really appreciate it. This area here, then we go in and we're cleaning the sides of the extraction site, and we're checking it to make sure there's no infection here, and then we're going to use a drill at 1200 RPMs to make sure that it's all clean, and we extend the length of that because we're going to use it that's a little longer than the tube. Then over here, we are going to step up the size of the socket so it can accept the implant at a 750 RPM. The slower drill to increase progressively the size, width, and length of the canal and the new implant. After I do this, I can tell the patient if I can put the implant in or not, because I want to make sure the infection is totally out of there. Sometimes I'll actually use a laser to go in there and clean the area, make sure that it's all cleaned out, and it hasn't failed us yet, thank goodness. But now, this is the new step. We go in and we place the plasma-rich fiber into the socket and then place the implant. So I put that in there as deep as I can. I'm not worried all the way up to the top, because when I place the implant in, what's it going to do? It's going to pack it. And if we needed bone to add to the area, I could add some bone in that at this point, and the implant will take it in. Now, our RPMs are all the way down to 40. This thing goes in slow. So it's in a very special package. If I have this going there and I go over to the patient and I drop that implant, it's no good. It cannot be reused. Slow use, high torque to place it, which is shown here, being picked up by a special attachment drill. The implant is in a sterile container. And then we start placing it in. It's very slow. You have to maintain your angles and everything. And then over here, placement of the implant is finished with an implant wrench. You can really torque down on this thing is what it basically tells you. And then what you want to look at, which I didn't get pictures of in this case, is how deep do you go? And we'll take an x-ray to check that. Better control for final placement, not shown as the adjustment of the implant to fit. Well, I think we found that x-ray coming up. Suturing tissues around it because it was a extraction site. And sometimes we have an Invisalign type splint to protect the tooth, so it's one piece. And then since it's one piece, your tongue can play with it and knock it loose. So you want to protect it. In this person's case, we had a very interesting situation. We prepared the implant here. And then once we checked the bite and everything, we were able to see that we had a nice future site for a crown to be placed. But you don't place it for 6 months in the upper arch, 3 months in the lower arch. Now people ask me about clear choice. You know, you got brand new teeth to put in. I can't list the number of malpractice suits they have against them in the United States today. I don't know how they do it. I've asked experts in implants how they do it. They can't figure out how they're doing it. It is a ceramic implant. The advantage is it's one piece. The disadvantage is it's one piece. The reason it's a disadvantage, if your tongue plays with it, you can knock it loose. It needs time to integrate. So when we get all this done, we take a look. Now remember, I told you we squish the Fibrogen, and all that liquid goes down. What's in the Fibrogen liquid? Growth factors, stem cells. Isn't that a great thing to put in the person, their own stuff, instead of something foreign? So we inject that. And we have seen surgical sites heal in 7 days, which normally takes 14 to 21. It is the most amazing thing in the world. It's very simply just put it in the buccal mucosa. And then what we did, we decided for her, was we made a little crown for her because it worked better than the splint, and she couldn't hit it. She couldn't bite it, and she wore what's called a night guard at night so she wouldn't play with it with her tongue. So, that's it, folks. Questions?
Fluoride or no fluoride toothpaste?
Oh, worship the world. Pardon my French. Fluoride is a neurotoxin. No fluoride. If you want something to put in your toothpaste, xylitol. Xylitol, the product is called Spry, S-P-R-Y. Best stuff in the world. And if you want a candy that tastes good, Spry. Why? Anti-carcinogenic. It helps digestion. And it's sweet. And this society needs to be a little sweeter. Yes?
Just for like reference purposes, how much do you charge like for an initial like consult to look at their teeth, like do their X-ray?
You're going to think I'm dumb, and I'm not trying to dodge the question. I honestly do not know. If you call and ask, they can tell you. But I'll tell you what we do in our initial appointment is you come in and you get your full series of x-rays, and you also get a panoramic. Before we start, we give you a homeopathic. Anybody know what it's called? Radiation. We give you the radiation drops before we even get started. My biggest fight is with my staff. I tell them to take 5 drops before they start a date. You think they do it? No. I don't get it. But some of them do, some of them don't. Yes?
Do you have any autologous stem cell applications for regrowing dentin and enamel?
Not that I know of.
And then if a patient had a matrix to inject their own stem cells on, would you be willing to do that procedure?
If we can get it under an RIB and I'm protected legally to do it, call me.
Can we waive all that with a consent?
Pardon? Would I do it with a consent? Talk to me
Where do we
later.
get an IRB?
You got an institution here. How do you not get an IRB or RIB, whatever they're called? Investigational Research Bureau.
No, I mean, do you have one set up? Or
No, I don't have one set up. My biggest problem is time. Let me finish with the initial visit.
Sure.
When we're done with the x-rays, we do a full exam, what's there, what's not there. Obviously, we've reviewed your full health history. And then at that point, we tell you what you need, we sit down and talk to you. I'm there, and I have another doctor, associate doctor, Dr. Kovar, great guy. He was my son's instructor at dental school. And he had moved down here, didn't even tell me he was looking for a job. And when I found out he was looking for another job from where he was, I made room for him because he's really a very, very talented person. Plus, he was willing to learn biological dentistry. You know, he got it right away. Question? No, okay. Yes?
What are your thoughts on oil pulling?
You know, I don't know enough about oil pulling to comment on how to do it, but I know it works. It does take toxins out. We've had people who have had abscesses and stuff, and we've put them on homeopathics, and we put them on antibiotics, and they followed up with oil pulling, and it really has helped. It will not clear a depot lesion. It might help take some of the toxins out, but those things don't heal. They need to be cleaned out. And I'll tell you, I have a group of guys that sit there and say, well, we'll shoot it up with ozone, and then we'll take a cavitat, and we'll show you that it's healed. Well, my dissertation was on the cavitat. And how you get false positives with a cavitat is shoot it up with homeopathics or shoot it up with ozone. And then it will show it's healthy, and it's not. And we have surgical proof to show it. So we did those experiments and went from there. Let's just go this way. Yes?
What's your approach for kids with cavities?
Well, we take a look at the child and see what the cavity is, how bad they are or whatever, and we remove the cavities. We try to use nitric oxide instead of injections because on baby teeth that's usually very effective, but it's a case-by-case situation.
Okay, and what are your thoughts on resin composites?
What's my thoughts on resins?
Yeah, resin composites.
Composite resins is what we use in the practice. You know, everybody comes and goes during this time, and I understand that. But there are over 800 different composites to use. Some of them are good, some of them are bad. So you have to With children, we usually muscle test them to see if it's compatible. Yes?
How can you tell if a problem that you see in the mouth is something that you need to take care of in the mouth versus, telling your patient, oh, you have this issue at this particular point that corresponds to the liver, go take care of the liver versus me doing something?
Well, many times what we see is we see diabetes. And so what we do is we try to refer those patients outside their health insurance policy. In other words, to naturopaths and homeopaths.
So it doesn't depend on the actual illness itself versus...
Of course. I mean, if you see cancer in someone's mouth, I try not to be the one to treat it. I try to send it to the right place for that. I've had some people refuse going to oral surgeons, and I've taken out cancers. And as the oral surgeon, Dr. Oko said, thank God you're too smart or too dumb to know when to quit, because I don't quit until I get the cancer out. And I sometimes overextend it, but the patient is very much alive at 86, and that was 15 years ago when I first started this stuff. If we see something that should be looked at both ends, we will tell the patient to go back to their physician. Most of the time when we get a patient, they're a referral from a physician, a friend, or off the internet. And they already have care with somebody. So if one of your patients comes in, and I know that they're your patient, I'm not going to refer them out to somebody else, I'm going to refer them back to you. As I would hope that somebody would have the courtesy to do the same to me, or some of my other colleagues who are biological dentists in the community, not too many. But I try to make sure they get back to their doctor. Yes, ma'am?
Is there a way to know if the composite that they already have in their mouth is reactive or they're okay with it, like after the fact?
It's difficult to check on that. We had one patient where, more than one patient, where we muscle tested them, and we went back with that light I was telling you about, and we reset the material, and after it was reset, it was fine. But we have had people reactive to composites. I had a person who came to me, she was somebody else's patient. The man did excellent work. He's a traditional dentist. He doesn't know that mercury is bad, but he knew that composites, you don't put mercury up in the front of the teeth, are called the buccal surface. So I sent them to an NEAT practitioner and got them detoxified. If I tried changing the material out, at least, there were 14 teeth involved. I'm going to hit a nerve somewhere. It wasn't worth the risk. So we first will try to get somebody to an NEAT provider or somebody. There are other techniques too, but we try to get them detoxified if we can. If it doesn't work, then you have to see what's the next step. Each case is an individual. Any other questions? Yes?
Are you open to naturopathic student coming in?
Am I open to a student coming in? Heck yeah. We have had a few dozen naturopathic students shadow for a day, come take a look. I've had the residency program come in on a Saturday, and I went through things, and then we put each one of those naturopathic students had to come in prior to doing the class, and we did like a full exam on each one of them. And then when we did the clinic with them, we discussed with permission each case. We had one young lady, she could open her mouth about this wide. She couldn't eat a sandwich. So I said, okay, we'll take care of that when you come in. She said, how are you going to take care of it? I said, trigger point injections. So we went through all the exams and everything, and I did her trigger point injections. She had a 24 millimeter opening. She was almost a 50 by the time we got there. You want to talk about a happy person? She ran out, and you know what she did first? Had a sandwich. Had a sandwich. When you have stuff like that occur, you don't know if it's going to work or not. We have had so many women who are pregnant and sick, and I do acupuncture injections up here and down here, and their nausea goes away. So it's been a very useful thing. Janet Travell's book, Neuromuscular, what was that? Trigger point injections. Janet Travell, she was President Kennedy's personal physician. And David Kennedy, another David Kennedy was a co-author with it. Really useful to do. And you can do throughout the whole body. I'm more comfortable shooting in the mouth. Yes?
Can you talk about the trigger point injections? What are you injecting?
Okay, on the trigger point injections, usually it's a Marcaine, Polocaine, norepinephrine. It's an anesthetic. I will add Trameal, and sometimes I'll muscle test, and sometimes I'll add Muke, depending upon what's needed. Everything's very specific. And one of the main reasons I usually do the mouth is that way I call it dentistry and not medicine. I'm not licensed in the state to practice medicine. But the good thing about dental insurance, they give you just enough money every year to slowly kill your patient so you can collect more money along the way. And unfortunately, that's a true statement. Look in the patient's mouth, see if they got a lot of fillings. Look at their gums. If they're not nice and tight and pretty, there's a problem. Could be diabetes, could be digestive problems, it could be inability to heal properly. Hemophiliacs have terrible gums. Anyway, that's it. I want to thank you guys. You're
Awesome.
great.
Thank you.